Hi, this is Dr. Wright again from Walnut Creek Animal Hospital in Purcell. We're continuing our first aid series for the working class canine. And basically where we're at now is we're going to discuss rescue breathing or artificial respiration. So we have a dog that has been acutely injured, either head trauma, chest trauma, something that's rendered him in a state of incapacitation. Ultimately, we recognize two things. One is that he does have a pulse, either via palpating around the heart area or the femoral artery in the back leg. So he does have a pulse. We've observed him for 30 to 60 seconds and we have not seen him take a meaningful breath. So no chest rise and fall. The next thing that we also assessed was we looked in his oral cavity to make sure that he didn't have some type of upper airway obstruction, and we've swept the back of that throat to make sure there wasn't anything in there that we couldn't see. If there was, we've retrieved that or something like that. So we have the non-breathing dog with a pulse at this point. So now we're going to move to rescue breathing, and the way we do that is it's going to be a mouth to nose sort of breath. What we always got to remember is a dog that's unconscious, the tongue can fall back into the caudal pharynx or the back part of the oral cavity and cause a functional obstruction. So whenever you blow air through there, the air wants to come back out the mouth instead of go down into the trachea, into the lungs to inflate the lungs. So what we're going to do is we open the mouth, we pull the tongue partially out, and then we gently close the mouth or the teeth onto the tongue and wrap our entire hands around the muzzle. At that point, we're going to place our mouth over both nostrils. And then we're going to watch for a chest rise and fall. And I'm just going to demonstrate this. This is obviously a mannequin, so its chest won't rise and fall. And we're going to give 1 to 3 breaths, or we're going to give 1 breath every 3 to 5 seconds. We're going to do that 10 times, and then we're going to watch again and see if this dog has started breathing on its own. So the way we do that again, pull the tongue out, close the mouth, and then and watch for a chest rise and fall. So we're going to do that 1 time every 3 to 5 seconds, a total of 10 times, and then monitor him for breathing. So that covers rescue breathing.